Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to talk about pediatric care in the most difficult ways and some of the more, shall we say, new focus ways in which we deal with our little babies, your grandchildren, your children, your nieces and nephews. So let me introduce to you first Dr. Patricia Rowe King, who is sitting in front of me. And she's the medical director of pediatric emergency services at Broward Health, as well as, in a sense, Coral Springs, and a little bit actually in the system. Let's put it that way. And you're a hospitalist as well. And we'll explain to the people what a hospitalist is. And you're the program director of the pediatric residency, correct?
That's right, sir.
So there's a lot of work that you have to do. Welcome.
Thank you.
Thank you for being here.
Glad to be here.
And we have a rather new Floridian in Dr. Risa Wolf, who has a very interesting subspecialty in pediatrics. She's a pediatric endocrinologist. Welcome, doctor.
Thank you.
Thank you for being here. So, Dr. Patricia Rowe King, tell me about you have an unbelievable task in your realm. So give us a quick rundown of what actually you do.
Well, I oversee pediatric hospitalist services and emergency room services at Broward Health. Broward Health Children's Hospital spans the entire northern part of Broward County. We take care of all pediatric patients. We practice family and patient-centered care in our system, and we have the full complement of pediatric specialists to take care of any child regardless of their problem. So in our two main facilities of the Children's Hospital, we have two 24-hour pediatric emergency departments, one located at Broward Health Coral Springs and the other at Broward Health Medical Center in downtown Fort Lauderdale. In those hospitals, we have 24-hour pediatric emergency room physicians seeing our patients, and we're able to deliver any care necessary that a child might need. In our location, downtown Fort Lauderdale, it's a level 1 pediatric trauma center. We also have two pediatric intensive care centers in our system, one at Coral Springs, a level 2 pediatric intensive care unit at Coral Springs, and a level 1 trauma pediatric intensive care unit in our downtown location. We have two neonatal intensive care units in our system. Again, one in Coral Springs and the other a level 3 at Broward Health Medical Center in the downtown location, level 2 neonatal ICU out at Coral Springs. Both of those units are manned 24 hours a day by neonatologists that are in-house. We also have two pediatric floors with pediatric hospitalist coverage. So no matter what time of day your child shows up at any of our Broward Health facilities, there's a pediatrician or multiple pediatricians on site to take care of them. They're manned 24 hours a day, where we admit children that have to stay in the hospital and take care of them. Our system also offers many other pediatric services. As we said, we practice family-centered care, so we have child life specialists, music specialists, humor therapists, art therapists that help take care of our children. We have pediatric rehab services at both facilities. We have a wonderful pediatric concussion program out at Broward Health Coral Springs. We have hospice and palliative care services. We have pediatric case managers, pediatric social workers, pediatric pharmacists. So our system is completely equipped to take care of children with all pediatric trained specialists.
Well, that's a big bag full of services, isn't it?
Yes, sir.
You have an unbelievable responsibility.
Well, we also have a pediatric residency program, which we're very proud. This is the 4th year of our residency program, so we're training future pediatricians in our system. And we're developing certain niche services. So Dr. Wolf, who has joined us this past year, is working arduously on developing a pediatric diabetes center and obesity center, and also manning our pediatric diabetic camp. So I'll have Dr. Wolf perhaps.
Dr. Wolf, let's talk to you because really you're a pediatric endocrinologist, which is really rather special. I mean, I know the kind of work, but for the audience, Tell us the spectrum of your responsibility within your subspecialty.
Some of the problems that we see in children for endocrinology include diabetes. That's the most common problem that we take care of. So any child with pediatric diabetes type 1 or type 2 would come see us in endocrinology. Some of the other more common problems that we see are growth-related issues. So whether you're too small or too tall, or if your puberty is starting too early or too late. We also take care of thyroid issues. And some of the more rare things we take care of are related to adrenal hormone problems, genitalia issues, disorders of sexual differentiation. These are quite rare problems, but they do exist, and we are equipped to take care of them. So that's our general patient population.
Do I assume that do you work only at Coral Springs, or do you are on call, in quotes, down to Broward Health? I would assume.
So I have privileges at both hospitals,
Right.
And my main endocrine practice is at Broward Health Coral Springs, and that's where we're establishing a new endocrine practice. And I also see patients in the hospital there. So that is a new thing for Broward Health Coral Springs. We did not have pediatric endocrinologists at that hospital before. So now we are better equipped to take care of patients who are coming in very sick with diabetes, or patients who are newly diagnosed with diabetes. And since I've been here, we've completely revamped and initiated a new diabetes education program for new onset diabetics, for them and their families. And this includes education related to how to generally take care of diabetes, how to check a blood sugar, how to administer insulin, how to learn the nutritional aspects of it in terms of counting carbohydrates and figuring out exactly how much insulin you should give. So we've changed this program significantly, and we've actually come up with a brand new diabetes education manual for the families and their children. And we've had a lot of success with it thus far. So in the hospital, we're able to take care of all of these patients, and also anybody who has an endocrine consultation. So they have maybe a pituitary problem or any other hormonal issue, we're available to see them in the hospital as well.
You know, we're at Nova Southeastern, we're very involved with the American Diabetes Association, and we are being looked at the moment by the national organization to be a center for their research. So I certainly, with our long-standing relationship, I mean, we've had a formal relationship with the North Broward Hospital District, now called Broward Health, since 1990. But it would seem feasible that with the multiple number of interreactions that we have through the whole spectrum of healthcare in the Broward Health system.
Absolutely. We have had a full restructuring of our research department. We just actually hired an administrator that's going to be over researching the entire health system.
Right.
As we grow as an academic center, we have multiple residencies and fellowship programs that we're developing here at Broward Health, and the research program will go hand in hand with our educational program.
Well, I'm certainly aware of that. I mean, I'm aware of it because, like I said, we of the 100 and whatever 20 some odd
Students.
Residents and fellows, I think we are participating in that number to the greatest extent. But I will say to you, Dr. Wolf, that really this gives an opportunity for the services that have been available for many, many years at what the folks know as Broward General, which is the hospital in Fort Lauderdale, which is Broward Health. But there is such a dramatic need now to look at the spectrum, not necessarily of the subspecialties, but the spectrum of knowledge that lies inside the subspecialties, because we're entering into a new era of healthcare treatment forms with all of the genome and biomedical or bioscience involvement. The whole issue of translational research is different than the research of the past. It's no longer test tube research, it's computational research, it's the knowledge of what factors we can place into it through bioinformatics, through the knowledge of what is going on within the patients, and try to give back to the physicians knowledge so that they can use it in the most efficient and, to tell you the truth, costly and cost-less manner to the patient. Is that true?
Absolutely, and we as a hospital are advancing our research initiatives, especially for the staff as well as the trainees, the residents and the medical students, and it's definitely something we're working on. In terms of collaborating with the NOVA faculty and some of the wonderful programs that you have here, there is the IDEAS program, which is a interdisciplinary diabetes education program that actually goes out to the community. And we're already starting to work on collaborating with our future diabetes center at Broward Health to utilize the resources that are already available within the community. As a safety net hospital for our community, one of the big initiatives that I'm working on is developing a pediatric comprehensive diabetes center. And this would be a center where a patient will come with diabetes and they would see me as the endocrinologist, and we have 2 other endocrinologists on staff, Dr. Wrightblatt and Dr. Blanco. And in addition to seeing the endocrinologist, they would also be able to see a diabetes educator. And these individuals usually review carbohydrate counting, how to take care of your daily needs with diabetes, as well as a nutrition consultation and psychology evaluation and continuing care. And the goal is that we provide all of these services really at no additional cost to the patient, but such that the patient can come and receive comprehensive, really total care in one visit versus having to get a referral to see a nutritionist or go to a psychologist, which most of the time doesn't ever happen. So it's one of the big initiatives we're working on, and we're hoping to establish this program this summer, really in coincidence with our diabetes camp that goes on every June up in Coral Springs. With the development of the Diabetes Center, also we hope to get more involved in some clinical research trials. And now that the translational research space will be available at NOVA, hoping to collaborate and maybe do some translational research.
That would be very valuable, not necessarily to the units that you work for or your employers, but more importantly to the patients that are out there. And the moms and dads and grandma and grandpas that are out there are very, very interested in trying to make sure that the ravages, particularly of endocrinologic issues, whether it be diabetes, whether it be thyroid, pituitary, or otherwise, and we're going to talk for a minute on thyroid, they should not have to go through what a lot of the folks who are what I would call the survivors of, shall we say, the best medical care that they can get, but yet we're getting ready to, we're going to geometrically exchange we're going to have an explosion of knowledge that's going to be coming our way within the next 5 years. And it's only for the benefit of the people who are viewing the show and the people who they care about. And it's really you as the flag holders to recognize that we have to be ready for the information that's coming our way. Dr. Roe King, you have been in the trenches for a while.
Yes, sir.
And you see the changing coming, don't you?
Absolutely. We see how we used to practice medicine, and now we realize that even though we have the greatest medical system in the world, we still may not reach all the patients that we need to. We have to work a lot more on prevention. We have to be out in the communities. Sometimes we have pediatric patients in the communities that even though care is available, they don't know how to access the care. So at Broward Health, we are partnering with a lot of our community partners on various programs. So, for example, the concussion program we have going on out at Coral Springs. We have a very robust drowning prevention program. As we all know, Broward County rates one of the highest counties in the entire United States for drowning many, many, many weeks a year, which is very, very catastrophic. So we have partnered with, and we go out to, and we educate communities. We're now even looking at the senior citizen communities. Many times the senior citizens are taking care of their grandchildren during the summer and spring, and they don't know how to swim. The children don't know how to swim, and drowning will occur in those situations as well. So we're really trying to educate the community as a whole on drowning prevention. We're starting in all our hospitals. As soon as a baby is born, we're trying to educate their families. And every time a pediatric patient accesses one of our emergency departments or clinics or hospitals in any way, we provide them with drowning education. We're also working on literacy. We realize that many children may have neurodevelopmental problems that were previously missed or not identified, and many adults are not literate. And then we're asking the adults to provide medication or do complex treatment like diabetes management of children, and they themselves are unable to understand or to read what we're providing to them. So every child that accesses our program, we have a very robust, again, Readers as Leaders program, where our children are all read to. The residents are involved in this program as well. They're given a book on discharge, and we promote literacy from birth onwards. So we realize that the way we deliver care is completely different. And we really have to address all the things that are affecting these families on an ongoing basis. And it's too late to wait until they are in the hospital. We've got to get out to the community and start there.
You know, I'm glad you just said what you said, because it really does. You know, healthcare is far more complex. It's no longer come into my office, let me examine you, or I'll see you in the ER, or I'm hospitalized and I get to see you, and this is what I prescribe. It's no longer that. It's completely different. With all due respect to the wonderful physicians and the pioneers of healthcare that are still with us and working hard to do what's best, but the whole responsibility of providing healthcare is going to be in a different chapter, and maybe even in a different book. It's not just knowledge, it's the application of information which is coming your way that is going to be quite forward-looking. It's going to be a new world. And I don't think that I'm overstating it.
Absolutely not. And we have to empower our families to be able to understand and take control of whatever illness and disease process their children are experiencing. No longer is it, the pediatrician is going to treat this. We're all going to be treating this on a daily basis. For a diabetic patient, they have to be eating a certain way, using the medication a certain way, doing exercise. We realize that our children are really unhealthy. They're inside playing video games, not outside, not exercising. We've eliminated physical education in schools, the arts, etc. It's so multifactorial that we really have to be out there empowering families, educating parents, that they really have to fight for their children in all aspects of their care.
With reference to that, and like I said, Dr. Risa Wolf, I know you just came from Johns Hopkins, and there's a different view of healthcare in certain parts of the nation. You can go to Seattle, Washington, you go to San Francisco, Los Angeles. It's called the style. The style of medical care is different than it is in New York or in Baltimore, or even in the so-called epicenter of healthcare, which is Boston, Massachusetts. But when you really get down to it, I believe it's the presentation of information that is not necessarily inherent within your knowledge, but it is inherent within the new knowledge which is coming your way. There's a lot of new information that's coming your way. True?
That's absolutely true. I mean, there's new manuscripts, new literature being published every day on all aspects of care. I mean, related to diabetes. I mean, we're even rechecking things that we've been doing for decades. And people are actively doing research and assessing what we're doing and looking for better ways to manage our patients. I mean, this is especially true in diabetes care because now with the onset of new technology, we have continuous glucose monitors where a child can wear a device that's about this big that will continuously monitor their glucose levels 24/7. I mean, this is great in terms of monitoring blood sugars, but it's also a very big relief for parents who can now sleep through the night knowing that their child is not going to get low, but if they do get low, that the actual machine is going to buzz off and wake them up that their child is going low. So it's been very helpful just in managing diabetes and better controlling it, as well as for the families.
Let me just get into something real fast because we don't have very much more time. Believe it or not, we really should do 2 shows on this. But obesity is, I mean, it's not only an epidemic, it's endemic, and particularly in this nation. And I understand, you know, it's the overeating of things that people don't know what's in that product. I mean, nobody understands label reading. It's very difficult when you pick up a cereal and it says no sugars, but yet you look down into the ingredients and there are all the elements or the esterified units or whatever it is that all relate to alcohols, which really relate to the sugars. So talk to me fast.
So one of the things that we educate our patients about right off the bat with diabetes is how to read a nutrition label, how to assess what's actually in the food that you're eating. I think this is a very important component of all pediatric care, and you know, I'm trying to implement that in our endocrinology department and in the diabetes center. But I do hope also that we can establish this as a wider community program for obesity. Right now, Broward Health is establishing an obesity center for patients that are obese, for children with obesity, that will also incorporate a nutrition evaluation. But I think more than that, going into the community and helping to better the nutrition education in general for our surrounding community in Fort Lauderdale, in Coral Springs, and these are big areas of need where we can actually help them and educate them. And actually that's some of the programming that I'm speaking about with some of the NOVA faculty right now in terms of how we can incorporate and make some new initiatives in the general community for obesity prevention.
Well, we're very proud of the IDEA program here,
Yes.
and Dr. Terry Morrow, who you probably have
Yes,
communicated
very well.
with. We are totally invested in making sure that this information is disseminated to the community, because it's not only knowledge, but it's the advocacy, and you know, to have the advocacy is really the connector. I mean, it's the way you plug into the wall and say, okay, turn on the light. And that's what I see. I mean, you have to have the advocates. Let me get quickly, because we're down to the last couple of minutes of the show. At Broward Health, at Broward General, which I always want to talk to because I'm trying to locate for the people, that is a trauma unit.
Right, we're a level 1 trauma center.
Right.
And we have a level 3 RIPIC and ICU.
Right. And so, but what that means to the folks out here is the incredible super subspecialty coverage that is there, because it is, being a certified trauma unit, it requires for you to have these super subspecialists, and I know you're super, but I'm just saying these subspecialists who must be there for the purposes of caring for the children within 90 minutes of a call.
Well,
Right?
at Broward Health Medical Center, we have 24-hour coverage of pediatric ICU, neonatal ICU, emergency department, floor. We also have 24-hour radiology coverage, anesthesia coverage, trauma surgery coverage.
Right.
But between Coral Springs and Broward Health Medical Center, we provide the full gamut of all the subspecialty services. So any child in the northern part of the county or the tri-county area, if they access our system, they will get the full specialty of care. We work collaboratively and together to provide care and deliver care.
Well, we're down to the last 45 seconds of this show. It's gone by real fast. We really need another show to finish up what I wanted to talk to you about. But really, the purpose and the reason I've asked you to come to be present for these folks that are out there, they're all so interested in the care of the little children. And they want to know that in our community we have the best of services available. And not only at Broward Health, but to be very candid, South Florida is really a place where we have multiple children care venues, and we're very proud of that, because to have that, really not only are you healthcare professionals, but your advocacies for life and advocacies for quality of life, and that's what really is important. So I want to thank you for all your service. I know, Dr. Patricia Rowe-King, that you have an incredible responsibility, and we want to thank you for all the work that you do, because it is very, very important to these people out here to know that the children of this community are going to be taken care of, and I thank you very much.
Thank you, sir,
As
for the
far
opportunity.
as you, Dr. Risa Wolf, a new person here, but I won't call you new because now you're a veteran. Now that you've been on this show, everybody is going to know that you're a veteran. So I really am pleased to know that we have a pediatric endocrinologist, although you have others there. But it's very important to be able to merge your responsibilities with the advocacy responsibilities. And they only want to be able to help you do your job. And I'm very pleased to know that you've been in contact with IDEA, because it's a very important venue with reference to diabetes. So thank you both for being here today. Folks, I hope we gave you some information relative to your little ones, otherwise known as children and babies. And know that really here in South Florida, we have really, shall we say, matured over the years to bring so many services to this area because of the younger families that are giving birth to children at a really very high rate in South Florida, and the need for knowledge. And these folks are the pinnacles of providing not only care but knowledge back to the community. So we thank you for tuning in. Remember, if you have any questions or thoughts, there's an email address here and a telephone number. Be sure to just let us know. And remember, these shows really come from your comments and your interest in certain subject matters. So if you have something you want to know about, just let us know. This show comes to you from Nova Southeastern University. It's called Dateline Health. I always tell you to take good care of yourself, but in this case also not only to take good care of yourself, but pass on information so that your children, your grandchildren, or your own little children have an advocate in your knowledge. So take good care of yourself. This show, again, is called Dateline Health. My name is Fred Lippman. Until the next time, see you.